So they asked about dental crowns types. So then again, just like fillings, there are a lot of different materials out there. We have gold, we have porcelain, we have zirconia, which is a stronger porcelain. So it all depends on the case, I would say, and what the condition of the tooth is when the patient comes in. But then again, even with crowns, sometimes the cases get really complicated and the prognosis goes down. So the earlier we catch things, the better.
Absolutely.
Yeah.
But I will say that compared to just 10 years ago, 15 years ago, the availability we have of making beautiful crowns today is completely different. It's
you know, the old days you had the metal or the porcelain fused to metal, and you always had this dark shine around the gum, and especially the front teeth. It's just not looking great when you have this grey shadow around the gum.
That's not a problem to the same extent anymore.
No, exactly. Now with the new full porcelain crowns, it looks so much better.
But some patients are not aware. They think like that's how crowns are. Like they say, oh, if I get a crown, I will have that line, and that's not the case anymore.
That's definitely not the case anymore. So it's so much nicer and easier for us to do really good-looking crowns these days.
And we have crowns that actually have the light go through them, so they look so natural. They're not blocked. They shouldn't look dead. When you get a crown on your tooth should still, unless the tooth is already dead. So so we can make it look very nice with the light going through it. And
I think one of the biggest changes is definitely the newer materials, but for me professionally here, that we have a ceramist at the clinic that we can just call in and say, have a look at this, and look at the neighboring teeth and make it match perfectly. For me to not worry about that it will be right if I measured and it's interpreted differently. He comes in, he looks at it, and he's out after 2 minutes, and you get a crown back that looks stunning.
And even at the same day before you cement, if you don't completely like the color, we can stain it in, and we can do that on spot, and that's the fantastic thing about really having a ceramic.
Big freedom.
Maybe we should talk about the procedure of the crown. I'm sure that's something that a lot of people wonder about. So with crowns, usually you come in and we prep it, we take an impression. A lot of people think they will live with the crown here. We all send it to the lab. So the patient always lives in a temporary crown, and then they come back and we'll put the final crown on. And then like you said, if they're not happy with anything, they always have the choice. We never cement it before the patient sees the crown. So you say, okay, I like it. It looks good, it fits well. We take an x-ray to make sure everything is perfectly fitting the tooth, and then we'll go ahead and cement it. Anything you want.
So approximately 1 week, 2 appointments, 1 week in between.
And there's been a lot of times that we put the crown on and the patient said, oh, maybe a little changes. We bring the ceramist, he does his touches, and then the patient still leaves the same day.
And sometimes it takes 2 minutes, and sometimes it takes an hour. But
and we have a nice waiting area where you can enjoy some coffee. And
the point is just that we're done when we're done. The crown is going to sit there for hopefully many years afterwards. So put it in a half an hour of time to perfect the outcome.
We never want to rush it.
Nothing.
No.
And also if there's something we see on the x-ray, if the crown is not fitting perfectly, we may actually send it back to the lab and have the whole new crown made. So we never put something in that's not perfect.